Well, thank you. My name is Markus Batchelor. I'm a candidate for DC Council at Large and currently have the honor of serving as the Ward 8 representative and vice president of the DC State Board of Education, a role I've had for the last 4 years, and before that served a term as an advisory neighborhood commissioner. I'm a third generation Washingtonian, raised in a working class family. My mom currently works as a home health aide after a career in early childhood education. My uncle and my grandfather both were meat packers at Safeway for over 40 years, and my dad was a postal worker. I'm running to work for working class families in our city to raise the economic floor, make sure more folks have access to truly affordable housing, that everybody in every neighborhood has access to the quality education that their children and families deserve, and that we have communities across our city that are both ripe with opportunity and free from gun violence. And so I look forward to ushering in a new generation of DC leadership that's going to fight for the bold actions and take advantage of this once in a generation opportunity we have to fundamentally change systems on behalf of folks left furthest behind.
This question is on rent control. Approximately 90,000 families live in apartments that are under DC's rent control program, making it DC's largest housing program. The DC Council's temporary universal ban on all rent increases exposes the need for increased tenant protections. What changes, if any, would you make to DC's rent control laws?
Absolutely, I appreciate the question. And since the start of this campaign, and I announced close to a year ago, I've been in full support of the full platform of the Reclaim Rent Control Coalition. And that means expanding and putting on a sliding calendar the way we grandfather in units that'll be accepted into rent control. I'm in full support of the 15-year limit to really grandfather units into rent control. I also think that we need to close the loopholes that, quite frankly, have allowed too many landlords to take advantage of tenants who live in very vulnerable situations, but also take advantage of what were really well-intended regulations to hike up rents and to make them out of reach for the families who need them the most. So I'm in favor of making sure that we take that 2% away, that we keep the cost of rents in line with the cost of inflation, and that we allow things like voluntary agreements and petitions to not allow landlords to hike the rents and keep them out of reach of our lowest income renters. Now, I'm a tenant, and so I understand, that very real anxiety. I've also been someone who's experienced firsthand the indignity of eviction, but also someone who enjoys a really good tenant relationship, but also live in a quickly changing community. I live across the street from the St. Elizabeth's campus, and so know the real impact that even my landlord has on trying to maintain affordability for our tenants. And so we've got to do more to keep affordable housing in our stock, but we've also got to do more to make sure that we support those folks who want to maintain affordability for their tenants and their neighbors.
Thank you. This question is on the eviction crisis. Thousands of families in DC are unable to pay their rent and are facing eviction when the state of emergency ends. What would you do to address this looming crisis?
Absolutely. The first thing we have to do is make sure we have leadership that understands the real severity of that looming crisis. And I think leaders who are willing to extend, quite frankly, the moratorium on evictions well beyond our public health crisis as we really help our folks left furthest behind recover in a real way. And so I was in favor and still am in favor of canceling rent from the beginning, knowing that folks who are falling out of the workforce or who are at least falling out of work for an extended period of time are going to have even higher overheads once we reopen and return to work, and paying back 3, 4, 5, or 6 months of rent just isn't in the cards for folks who are already economically insecure. So we've got to do more in terms of rental assistance to help people catch up. And I'm willing to fight for those resources from the council. And I also believe that we've got to do more in general to raise the economic floor for our most economically vulnerable neighbors. It's why I'm the only candidate in this race who's pledged to introduce legislation to to establish a universal basic income program for our most economically vulnerable residents. So we really lift the real burden of poverty and allow people to really get a new lease on life and move more quickly into the middle class. And so those are some of the things I'm thinking about, both as an immediate response to our COVID emergency, but as a permanent way we raise the economic floor and expand economic opportunity for folks who just haven't enjoyed it even before the crisis.
Great, thank you. Thank you. This question is on public housing. The DC Housing Authority states that the more than 6,600 units of public housing are in disrepair and need up to $2.5 billion to make critical life-saving improvements over 20 years. What would you like to see happen in public housing, and what would you do to achieve this?
The question, you know, through my work in nonprofit, I worked at a community-based nonprofit in Anacostia and worked directly with families living in the Berry Farm community, both as they grapple with the real challenges that exist in public housing communities on a day-to-day, but also prepared to transition during the impending redevelopment, and realizing that the residents, one, in our communities, their challenges are multifaceted and very diverse, and we've got to meet the needs like they are. So I believe that public housing in general needs to not just be concentrated poverty, but the public housing communities we maintain should also be hubs for the resources to move families more quickly into permanent supportive housing, not wrap them in generational poverty. What we do about the immediate needs that our public housing communities face right now, which quite frankly, in many cases are direct threat to the health and safety and security of families there, especially children on that property, is make sure that the housing authority has the resources it needs to make those immediate repairs and has the ability to implement those repairs quickly. And we also know that that means having the room to also temporarily relocate and rehouse folks in which their units are going to take a lot more work. And that's going to start with us prioritizing it in our budget, making sure that our budget is a more document that focuses on those fundamental quality of life things for our poorest residents. But it also means making those investments by doing something other than balancing the books on our most vulnerable residents. So I believe in making sure that the wealthiest folks in our city pay their fair share, that we don't ask DC government employees to be cheated out of a cost of living increase for the next 4 years as an alternative, and that we prioritize our $16 billion budget as much as possible into raising the floor for our folks left furthest behind.
Thank you. This question is on homelessness. From encampment clearings to the threat of COVID-19 outbreaks in shelters, we know that DC's homeless service programs are not working for many residents. What would your priorities be around addressing homelessness?
And my first priority would be to change the culture in this city that criminalizes the poor more than it criminalizes poverty. And again, my thoughts around making sure that we do things like create a guaranteed basic income program, but also invest as much as we can into ending chronic homelessness and moving folks into permanent housing is something that I have been hyper focused on throughout my career, both in government, nonprofit, and the last 6 years in elected office, but something that I'll fight for from the council. It means that we've got to provide better supports for folks who are experiencing homelessness. That means safe shelters that provide resources like education and job training, mental health supports, addiction recovery. It means that when we move people into housing, we have the stock that allows them to move into housing that they can afford. While we have a statutory regulation for producing housing 30% of the AMI or lower, year after year, DC misses that metric. And so I'll be a council member who provides strong oversight to make sure that we use our housing production trust fund dollars where the private sector and the development community won't go and fill that critical need. And then again, for folks who want to own in this city and build wealth, the inequality between Black residents and white residents to do that is astounding. And so we've got to, again, raise the economic floor, allow more access to capital for home ownership and investment in the community that allows folks to build equity and wealth. And that's how you not only interrupt poverty, but you raise the economic floor permanently for those who have been left behind, which has a generational ripple effect across generations. That's both a short-term solution to what we're facing ahead of us, but also a long-term economic advantage for the District of Columbia.
Thank you. This question is related to workers in DC. The impacts of COVID-19 have revealed the lack of a real safety net for workers in DC, particularly undocumented workers and those working in the informal and gig economy. How would you address these issues?
Well, you know, as I mentioned earlier during my introduction, I come from a working class family, and my 70-year-old uncle is still getting up every morning and going to work at Safeway to cut meat. For her safety, I take my mom to work every morning. She's working as a home health aide. But, you know, folks like my mom also aren't getting paid what they deserve. And they aren't being adequately protected, quite frankly, during this crisis. My mom has to buy PPE out of pocket. She has to personally worry about her safety, right, as someone, you know, in her late 60s, but also the safety of her patients who are in very vulnerable health positions. And she just doesn't get the support from her workplace that she needs. So when I talk about fighting for workers in our city, I mean it because I know firsthand what that looks like and feels like right now in this crisis. And so I for sure make sure that we provide better protections and mandate better protections for workers, that more of our frontline workers get access to PPE, that hazard pay is something that more folks can enjoy, that we expand worker protection and workers' rights. So folks like my mom can take a day off to care for herself or for my 93-year-old grandmother, or tend to her personal needs that helps her grow and expand. Those are the things that I'll continue to fight for as a member of the council. And I think in this immediate health emergency, given how important our essential workers and the fact that we're now recognizing that they're essential, even though they've been essential all along, means that we should do something differently, not just during this crisis, but permanently moving forward to show our frontline workers how critical they are to the way our city runs.
Thank you. This question is related to racial inequities in DC. The coronavirus pandemic and Black Lives Matter movement have brought to the forefront issues of systemic racial inequalities in DC. We know that around 80% of the COVID-19 related deaths in DC have been Black residents, who only make up about 46% of the population. What do you see as some of the underlying factors contributing to these disparities, and what would you do to tackle them?
You know, I oftentimes get that question, and I am immediately brought back to the thought that in some Northwest neighborhoods in our city, the life expectancy is somewhere north of 90 years old. While the community I grew up in and currently live in, Congress Heights in Ward 8, the life expectancy is only 67 years old. And so when we talk about the disparity across our city, it is quite frankly a matter of life and death. And I think COVID has exposed that in a very real way. But these are issues that I've been fighting for years beyond COVID. I've been talking about making sure that we have a quality healthcare system east of the Anacostia River, quite frankly, east of North Capitol, that provides both the preventive care, primary care, and urgent care that all of our families need, but also attacks the chronic disease that we've allowed to fester, especially in communities of color. It means making sure that hospitals like United Medical Center that currently don't have an obstetrics unit, while they serve a community with the highest rates of infant and maternal mortality in the city, get the resources they need to fill that critical gap, and that we think of a healthcare system as more than a hospital, but as a network of supports that also includes access to fresh foods, groceries, and nutrition. I think beyond that, we've also got to realize that the life expectancy of someone like me astronomically goes down because of my larger likelihood of being a victim of gun violence in our community. And so we've got to attack gun violence as with a public health approach, not over police communities in which their sense of safety is already diminished by the presence of police. We've got to, again, raise the economic floor and provide opportunity that really makes our community safer. And again, I talked a little earlier about making sure that we increase the opportunities for Black folks in the city to build wealth. And I'm glad to work on those issues as well.
Good morning. My name is Markus Goodwin. I'm a DC native from Columbia Heights. I'm one of 8 children in my family, the proud son of an environmental scientist and a DC public school teacher. My mother came to this country from Senegal in 1985 because she believed DC was a place that where if you worked hard, played by the rules, and got the support of family and community, you could build a better life for yourself. For far too many people in DC, it's not the case that success and opportunity presents itself. We're moving in the wrong direction. For the past 20 years, I've seen the impact of gentrification cause real trauma and stress on families. So I'm running for DC Council now to ensure that every DC resident can be safe to get through this pandemic, get the support that they need, and we can transform DC into a stronger, more equitable city. DC deserves to be a place that's more than just a return to normal. It deserves to be a place that we're building back stronger than ever before. So thank you for your time.
This question is on rent control. Approximately 90,000 families live in apartments that are under DC's rent control program, making it DC's largest housing program. The DC Council's temporary universal ban on all rent increases exposes the need for increased tenant protections. What changes, if any, would you make to DC's rent control laws?
Strong proponent of us ensuring that we reclaim and re-strengthen our rent control regulations. We should have more affordable units and rent controlled units in the city. It's an increasingly expensive city to live in, to work in, and they should be equitably spread across the district. A vast majority of our units are in wards 7 and 8, and it's not fair that we have the burden of many of our affordable units staying in particular communities as opposed to evenly distributed so that opportunity and housing choices are evenly distributed around the city. For that reason, I want to ensure that we are making every investment possible to ensure that we bring more units into our rent controlled overall program and agenda, and ensure that larger units are brought in so that more people who are families or larger groups of individuals living together have an opportunity to access affordable housing that's in our rent control program.
Thank you. This question is on the eviction crisis. Thousands of families in DC are unable to pay their rent and are facing eviction when the state of emergency ends. What would you do to address this looming crisis?
We need to look deeply at what laws are allowed in terms of eviction of tenants, and really, as a council, as a legislative body, start to create new legislation that will enable people to be able to stay in their homes, whether that be through individual financial assistance, or if that's through the city ensuring that landlords are able to cover their costs and don't have the legal pathways to be able to unjustly put people out of their property. So I think strengthening our legal framework is critically important, and filling any financial need. A large part of our platform is focused on economic empowerment and good paying jobs. I want to ensure that people have good paying jobs and skills through certification and DOES training, our Department of Employment Services, so that they can afford to live in their homes, but also that they can afford to be in rent controlled units that are more resilient from all of the price shocks from incidents like this pandemic right now.
Thank you. This question is on public housing. The DC Housing Authority states that the more than 6,600 units of public housing are in disrepair and need up to $2.5 billion to make critical life-saving improvements over 20 years. What would you like to see happen in public housing, and what would you do to achieve this?
Surprise, and it's really no secret that our public housing authority has really struggled to maintain our buildings with operating expenses that are necessary to keep consistent repairs. So I want to ensure that our public housing authority makes the investments to make these repairs, but also that we start to get management in that's better suited to organize and oversee larger affordable housing properties. Specifically, what does that mean? That means that we would have operators that work independent from the government be contracted to oversee the repairs and the property management, because our public housing authority has failed us on a consistent basis. That's why with operators that are independent from the government and giving the contracts to people that can maybe take up to 10% each of our public housing stock, we can start to create a system of accountability and a structure that will have people who have economies of scale in their affordable housing portfolio to be able to take on our affordable housing units. That's a strategy that's been taken on recently by the city of Miami. And I think other cities will start to see that buildings that are in need of repair because of their age or their condition or how they've been managed or operated can start to get private operators in who can help transition these communities, create family success plans for the individuals living in the building, create job training opportunities, provide daycare, provide job placement opportunities in a way that enriches people's lives. And we have a system of accountability beyond the government that the Attorney General can oversee.
Thank you. This question is on homelessness. From encampment clearings to the threat of COVID-19 outbreaks in shelters, we know that DC's homeless service programs are not working for many residents. What would your priorities be around addressing homelessness?
This has become an increasing issue. While the statistics say that homeless families have reduced in recent years, homeless individuals and their population have continued to rise. That's a problem. We should seek to be a city that has a home for every single resident. Many of our homeless residents have jobs. Up to 48% of our homeless residents have a source of income. And anyone, certainly with a source of income at the very least, should be entitled to have a home, including those who don't have a source of income. So I want to create more affordable housing options by doubling down on our Housing Production Trust Fund to also include units for those individuals that need to transition to having homes on a consistent basis, so that their sole source of housing isn't solely our homeless shelter program and system. I want them to be able to transition to a better place so that they have consistent housing, certainly in units that are rent controlled, but also in units that are in the private market as well, that are at an affordable rate that they can continue to live their lives and experience economic mobility.
This question is related to workers in DC. The impacts of COVID-19 have revealed the lack of a real safety net for workers in DC, particularly undocumented workers and those working in the informal and gig economy. How would you address these issues?
Foremost, we need to have an attorney general that is ensuring that we treat everyone fairly and overseeing that employers are not misclassifying their workers as 1099 workers instead of W-2 workers. So I really want to ensure that all workers, especially our undocumented workers, have an opportunity to be in employment that is protected, because workers' rights are among the most important in our city, because it really guarantees that a quality of life that is part of the promise of being in America and being in Washington, D.C. Holds up and has as a highest priority. That means that we need, as a council, to step up and provide PPE. We need to provide safe working environments. We need to ensure that the classification of workers are fair and equitable and just. And we need to continue to dig into our bodies, such as our Attorney General, to ensure that employers are properly treating their workers with the right equipment, with the right legislative rights, with the right benefits, and with the right employment agreements that fully respects their rights.
Thank you. This question is related to racial inequities in DC. The coronavirus pandemic and Black Lives Matter movement have brought to the forefront issues of systemic racial inequalities in DC. We know that around 80% of the COVID-19 related deaths in DC have been Black residents, who only make up about 46% of the population. What do you see as some of the underlying factors contributing to these disparities, and what would you do to tackle them?
We're really dealing with three crises right now as a people. We're dealing with our public health crisis, our economic crisis, and now our awakening on racial and social equity. It's been a problem that I've seen and experienced growing up in Washington, and now it's coming to the forefront. A lot of the health inequities, which account for the 46% infection rate, but 80% mortality rate for African Americans, really refers to the lack of access to public health, especially in Ward 7 and 8. Ward 7, 92% of the population is African American, and Ward 8, 96% of the population is African American. So it's important that we don't have hospitals east of the river like we do in other parts of the district. We only have 3 grocery stores for 162,000 residents, whereas in Ward 6 alone, there's 12 grocery stores. This makes it one of the worst food deserts in the country. When we extend and look into healthcare access, we don't have a hospital with level 3 trauma, a hospital with obstetrics, and that's part of why we have a maternal mortality rate that's 3 times for Black women what it is for their white peers, for white mothers. So we need to ensure that we're making investments east of the Anacostia River in our healthcare system. The Hospital of St. Elizabeth is a first step, but it should be one of many. We also need to invest in the type of incentives that create grocery stores, but also empower and enable local entrepreneurs to build their own community grocery stores. Food access, public health, and hospital access both need to be tackled. It's an economic question, and it's a question of our priorities. My priorities is to change these because the higher rates of underlying condition, obesity, diabetes, high blood pressure are not solely the responsibility and the fault of the people who are dealing with these crises. It's of a system, government, and healthcare that has not supported them in accessing the right food and healthcare that they need.
My name is Christina Henderson. I'm running for DC Council at Large. I've worked on political campaigns to help get some good people elected to office. I worked for a couple of school systems, including DCPS. I've advised and worked with US senators, and for 5 years, I had the pleasure and honor of serving residents in the District of Columbia, first at DC Public Schools, and then for 4 years at the DC Council. I'm running for the council because I believe we need a more equitable DC, and I believe we need more council members who are focused in on policies that are going to make DC more equitable and sustainable for us all.
Great. This question is on rent control. Approximately 90,000 families live in apartments that are under DC's rent control program, making it DC's largest housing program. The DC Council's temporary universal ban on all rent increases exposes the need for increased tenant protections. What changes, if any, would you make to DC's rent control laws?
Thank you so much for that question. So affordable housing is a priority of mine. And in the affordable housing context, we often talk about housing production, which I think is important. But for me, what I'm interested in focusing on is housing preservation. How do we preserve the affordable units that we already have? And rent control is definitely aligns within that. I believe, there's a study that says between 1985 and 2011, we lost something like 50,000 rent control units in the district. And so I support the Reclaim Rent Control platform, particularly as it pertains to expanding access to buildings, and also not just expanding beyond before 2005, but also tying expansion to a dynamic date so that we always have units and buildings that are coming into the stock, so that I don't want to say we never run out, but that there's always fresh stock available in terms of rent control to address the need of affordable housing in DC.
Thank you. This question is on the eviction crisis. Thousands of families in DC are unable to pay their rent and are facing eviction when the state of emergency ends. What would you do to address this looming crisis?
I feel like this is one of those things where COVID-19 has definitely amplified that housing should be a human right, because housing is something that is a necessity for all people, not just during a public health emergency. And so with that, I feel like for DC, and one of the things that I would be interested in doing as a council member is increasing our investments in local emergency rental assistance, as well as expanding upon our medium support assistance, whether it be providing, partial payments to help people, over, a period of a year or something to that effect. I think that when you look at what COVID has done to our economy, and particular workers in general, whether it be the hospitality industry or some other small businesses that are not running, at 100% speed right now, it's going to take people a while before they're able to get back on their feet. And I feel like it is incumbent upon the government to help ensure that those folks are able to stay in their homes during this period, and doing that the best we can, because having people be able to stay in their homes is the best way for us to be able to move forward.
Thank you. This question is on public housing. The DC Housing Authority states that the more than 6,600 units of public housing are in disrepair and need up to $2.5 billion to make critical life-saving improvements over 20 years. What would you like to see happen in public housing, and what would you do to achieve this?
So as I said earlier, one of the things that I'm interested in working on as a council member is housing preservation. How do we preserve the affordable units that we already have? And public housing is certainly part of that conversation. Prior to COVID, one of the things that I was proposing is that the council dedicate future surpluses to handling some of the critical health and safety repair issues that are within our current affordable housing stock. I mean, we have the data, particularly as it pertains to young people in the city who suffer from chronic asthma and then also live in public housing units. And it doesn't take a lot to sort of draw correlations and pull the data there in terms of, our housing is literally hurting kids' lives, and we aren't doing what we need to do. I think we can all admit that the federal government is basically out of the business in terms of, funding public housing in any true way. And so it's incumbent upon the district to step in to provide the resources necessary, not just to do the critical repairs, but also to build and modernize new affordable housing stock. I would like to serve on the Committee on Housing because I feel like there's a lot of oversight that needs to happen there, particularly as the Department of the DC Housing Authority is doing their transformation plan. I'm deeply concerned about the conversion of some public housing units and sort of the public-private partnerships that have there, because anytime we have ever endeavored to redo public housing, it has led to significant displacement amongst families in the district. And I think we need significant oversight there to ensure that that doesn't happen again.
Thank you. This question is on homelessness. From encampment clearings to the threat of COVID-19 outbreaks in shelters, we know that DC's homeless service programs are not working for many residents. What would your priorities be around addressing homelessness?
I support DC's goal around ending homelessness in the city, but I feel like we haven't done a really good job of matching our vision for ending homelessness with the programs that we have around affordable housing. For example, let's take rapid rehousing, for instance. DC holds this up as like our shining star in terms of handling our housing and affordability crisis, and yet we know that for the vast majority of people who are enrolled in that program, once their subsidy runs out, they cannot afford the market rate rent of the units, and therefore we are just starting the cycle all over again in terms of families and individuals experiencing, housing instability. I want to see us fine-tune that, but I also want to see us invest more dollars in permanent vouchers. We haven't invested in permanent vouchers in the city for years, and yet we know we still have this homelessness problem. Hotels are temporary solutions, but they are not fit for families. They are not suitable for children. And so, I support the family shelters that we have built, but I also feel like that is a Band-Aid on a larger solution. Unless we are retooling and really getting serious about what we're talking about in terms of affordable housing, I'm talking deeply affordable housing, like 30% AMI affordability, then we're always going to be at this crossroads where our goals and the resources that we're providing don't align.
Thank you. This question is related to workers in DC. The impacts of COVID-19 have revealed the lack of a real safety net for workers in DC, particularly undocumented workers and those working in the informal and gig economy. How would you address these issues?
Things that I would support as a council member is DC expanding its own local unemployment insurance to include permanently, independent contractors or gig economy workers, as well as undocumented workers. I feel like COVID-19 has, in many ways, highlighted the disparity in terms of our treatment of workers and how we, how the safety net is defined and who it is defined for. These are folks who are working just like us. They're paying in, they're doing taxes, all of these different things. And so I believe they deserve the protection that if you lose your job, due to no fault of your own. You should have the city safety net there to help you ensure that you can continue to pay your rent or mortgage, continue to provide food and support for your family. And so that's one of the things that I would like to see the council move forward on, and it's something I certainly would support as a council member.
Thank you. Thank you. This question is related to racial inequities in DC. The coronavirus pandemic and Black Lives Matter movement have brought to the forefront issues of systemic racial inequalities in DC. We know that around 80% of the COVID-19 related deaths in DC have been Black residents, who only make up about 46% of the population. What do you see as some of the underlying factors contributing to these disparities, and what would you do to tackle them?
It's so funny when I think back. The media was so surprised by the disproportionate impact that the coronavirus was having on Black and brown families. But for those of us who, operate and work in these communities, it was no surprise. We know that in health in general, your access to care only amounts for about 20% of your health outcomes. The other, 80% is related to things like housing, access to green space, air quality, education, all of these other things. And in DC, we are a tale of two cities. So it is not surprising that there has been a disproportionate impact to, Black and brown communities in terms of this virus, because we have, the ways in which we operate in our society is not equitable. It has been inequitable. I think that one of the things I've talked to folks about is around, like, for instance, public transportation. Our communities that are the most public transit dependent in this city are the ones that have the least connectivity in Ward 7 and 8, where they have maybe one bus line that comes in, or they have a train stop, but it's, 15 to 20 minute walk. And sometimes you're having to cross, 4-lane highways and all of these different things in order to get to it. We need to completely retool the way we do things in this city so that we are ensuring that everyone is able to benefit from the growth and that everyone has access to the equitable growth and change and progress that is happening in DC. And I haven't seen that happening. And that is one of the reasons why I'm running for the council, for us to get back to, focusing on policies, but also bringing in those voices that are often left out from the conversation as it pertains to some of these issues. So I feel like COVID has only highlighted what we've already known. And the next question is, what are we going to do to take action to change it? Not to get back to normal, but to get back to better.
Hi, I'm Ed Lazere. I am running for DC Council at large. I have been in the District of Columbia my entire adult life, and I spent the last 20 years working to make DC a more equitable and just place as the director of the DC Fiscal Policy Institute, where I did research on the city's deepest inequities and then partnered with organizations across the city to fight for a budget that did things like create more affordable housing, more equitable education, raising the minimum wage, and more. And I'm running for office because I'm concerned about how the city is changing and that our leaders aren't keeping up with it. I think it's wrong that the city's prosperity has come at the cost of rising homelessness, and DC being the worst in the city, in the country, in terms of displacement of Black residents. And I feel like our leaders say they care, but then don't govern like they do. So I'm running to be a council member who's ready to tackle the city's deepest racial and economic inequities at the scale they demand and at the urgency that they demand.
This question is on rent control. Approximately 90,000 families live in apartments that are under DC's rent control program, making it DC's largest housing program. The DC Council's temporary universal ban on all rent increases exposes the need for increased tenant protections. What changes, if any, would you make to DC's rent control laws?
Strong supporter of rent control. I think it's an incredibly important tool to creating family and community stability, and I think now is the time to strengthen it. Before launching my campaign for DC Council, I was a part of the Reclaim Rent Control advocacy campaign, and I strongly support that platform. Because we all know that housing security is critical to our own stability, our own family stability, as well as our communities, and stability of housing prices is part of that. If you're a homeowner with a fixed mortgage, you have that kind of price stability in your housing. But if you're a renter and subject to the market, you could find yourself priced out of your neighborhood as the neighborhood changes around you. And that's wrong. And that's why I support rent control, and in particular why I think DC needs to have a stronger rent control legislation. We know that right now our rent control law is full of holes and is highly inadequate, including the fact that it only covers housing built before 1975, meaning that every single year the universe of our rent control law becomes smaller and smaller. It doesn't cover all buildings in the city. It allows rent increases that go beyond inflation and substantial rent increases when somebody leaves their apartment. And worst of all, our rent control law has terrible loopholes that have allowed abusive landlords to get around it and raise rents exorbitantly on tenants. That's why I support the Reclaim Rent Control platform, including doing things like covering every single building in the city that's 4 units or more that's at least 15 years old, broadening tremendously the number of units that are covered by rent control, covering more and more of our population. I support limiting rent increases to inflation, including when a unit becomes vacant, not allowing rent increases at that point. And I support closing the loopholes that landlords have abused to get around rent control, including closing the voluntary agreement loophole.
Thank you. This question is on the eviction crisis. Thousands of families in DC are unable to pay their rent and are facing eviction when the state of emergency ends. What would you do to address this looming crisis?
It's shameful that thousands of DC families are at risk of losing their homes in the coming months because the pandemic took away their jobs and the income that they need to pay their rent or mortgage. And unfortunately, our leaders have done virtually nothing to stop this from happening. We face a looming wave of evictions and foreclosures as early as the end of this year. We can't let that happen. I think it would be a moral failure, a public policy failure, a communal failure if even one DC resident loses their home because they lost their income in the pandemic. And the only way to stop that is to stop evictions. We cannot let a crush of evictions destroy families and destroy our entire community, making our recovery from the pandemic much, much harder. I support banning evictions for anybody who got behind on their rent in the current pandemic, meaning if you couldn't pay your rent during the pandemic and the moratorium that applies right now covers you, that moratorium would be extended and you would never, ever be evicted if the only time you were behind on your rent was during the pandemic. I, of course, support federal efforts to help renters who are behind on rent pay their rent and hope that the next federal relief package includes that. But I also know that that's optimistic and we can't count on the federal government to save us, and we have to have policies to save ourselves. And that's why I believe the best policy in the city is to ban evictions, to make sure that that awful outcome that we all want to avoid we're able to avoid.
Thank you. This question is on public housing. The DC Housing Authority states that the more than 6,600 units of public housing are in disrepair and need up to $2.5 billion to make critical life-saving improvements over 20 years. What would you like to see happen in public housing, and what would you do to achieve this?
Well, I think public housing plays an incredibly important role in DC's affordable housing landscape as our lowest barrier form of affordable housing, and it serves many DC residents who are older or have disabilities or families with children. And we can't let this resource wither on the vine. We have to support it. Unfortunately, public housing is in terrible shape in many conditions in the district because the federal government has not lived up to its obligation to support public housing. Unfortunately, we can't expect the federal government to save us here. And that means we as a community here in the district have to take local responsibility for preserving and protecting public housing. Through my work at the DC Fiscal Policy Institute, I was an active part of the coalition encouraging the city to provide local funding for public housing and protect the rights of residents. And that's what I would continue to do as a council member. We know that proposed plans for redevelopment from the Housing Authority are inadequate and that they don't guarantee one-for-one replacement of all units at the sizes that they currently are. It doesn't guarantee a build-first approach where families aren't removed from their communities while the redevelopment occurs, and we don't have enough resources yet to fund public housing redevelopment. So my goals as a council member would be first and foremost to make sure the city is finding the resources to fully renovate and redevelop all public housing units that need it, but to do that in a way that protects tenant rights, make sure that everybody who is in public housing now is able to return to those units, that we're replacing units one for one, that we're engaging in build first, and that we're keeping public housing a public resource, not privatizing a single unit of public housing.
Thank you. This question is on homelessness. From encampment clearings to the threat of COVID-19 outbreaks in shelters, we know that DC's homeless service programs are not working for many residents. What would your priorities be around addressing homelessness?
I think it's a shame that DC's growing prosperity has come at the awful cost of rising homelessness and the growing number of people who only have a tent for a home. The fact that the district itself is now clearing tent encampments, displacing people from tent encampments is a further sign of how troubled we are and how much more we need to do to help every DC resident have the dignity of a home. Certainly at DCFPI, every day I go to work in Noma, I walked by tent encampments under the train tracks, and it broke my heart to see people who didn't have a home, knowing that the city had the resources to do something about it. So if I'm elected to the DC Council, I am committed to ending homelessness in the District of Columbia, making sure that it is rare, brief, and non-recurring. I would start with making a commitment over the next 4 years to fully funding the city's strategic plan to ending homelessness, and then hold us all accountable to sticking to that plan and finding the resources. That includes greatly expanding our permanent supportive housing programs. We know the targets, we know how many people are facing chronic homelessness. We just need to actually find the funding to expand permanent supportive housing. For families in particular, we just need more affordable housing, and that means investments in things like our housing production trust fund and our local rent supplement program. I support improving the quality of our single shelters, knowing that they are in awful condition and that many people avoid shelters as a result of that. Right now, in the middle of the pandemic, I want to make sure that everyone in a shelter is safe. So I also support greater use of hotels or other facilities in the city so that people who are experiencing homelessness can socially distance and not have to worry about their own safety. I also support more money for emergency rental assistance to make sure that people avoid homelessness in the first place. And I would stop clearing encampments, which I believe is a tragedy.
This question is related to workers in DC. The impacts of COVID-19 have revealed the lack of a real safety net for workers in DC, particularly undocumented workers and those working in the informal and gig economy. How would you address these issues?
I think as a community, we have a moral obligation to help anybody through tough times, including when they've lost a job, and now more than ever in the middle of this pandemic. Helping people with unemployment insurance also supports our economy by making sure that people still have money in their pocket to spend on rent, on groceries in their local economy. And as this pandemic has revealed the fact that our unemployment system is highly inadequate, including the basic unemployment insurance system, which itself just lacks the technical infrastructure to work well. And so many people try to access unemployment insurance and often waited months, and many are still waiting. But beyond that, we also know that there's a large number of workers in the city who just don't qualify for unemployment insurance at all. That includes people who can only find jobs in the gig economy. It also includes undocumented workers and other people in the informal economy, like sex workers. As a council member, I am committed, or I would be committed, to making sure that we have assistance programs for everybody who loses a job through no fault of their own, including right now in the pandemic. I spent the last few months in my campaign advocating for this year's budget to include funding for excluded workers. Unfortunately, we got only a modest amount, and much more is needed. As a council member, I would work to create a permanent program that mimics our unemployment insurance program for anybody who needs financial assistance and can document that they've lost income, a general assistance program of sorts. And that would include all the folks that we've talked about, or that I've talked about so far, excluded workers like undocumented workers and other people in the informal economy. We just need to take care of everyone and make sure that everyone has income support when they need it.
Thank you. This question is related to racial inequities in DC. The coronavirus pandemic and Black Lives Matter movement have brought to the forefront issues of systemic racial inequalities in DC. We know that around 80% of the COVID-19 related deaths in DC have been Black residents, who only make up about 46% of the population. What do you see as some of the underlying factors contributing to these disparities, and what would you do to tackle them?
So we know that any inequity that we see in the district by race is a result of long-standing systemic racism, whether it's the fact that the median wealth of Black households is only $3,500 compared to almost $300,000 for the median income of median wealth of white households, or the fact that Black household income is just 1/3 the median income of white households. These are a reflection of our long history of racism in access to education, in access to jobs, in access to housing opportunities, including federal and DC programs that denied opportunities for Black people to become homeowners, and also segregated our communities. We know that local policy in place right now maintains and sustains that racism. We have a tip minimum wage that for people who are for restaurants and workers and other servers, that's just $5 an hour. Most of those workers are people of color, and they face much higher rates of poverty than any other workers. We have a college savings program in our city that only benefits higher income families. We have failed to tax wealth in the city adequately, meaning that we have fewer opportunities to address racial inequities. The key to addressing these, first and foremost, is just to put race into focus in every single policy issue that we address, whether it be education, whether it be healthcare, whether it be housing. The REACH Act that passed this summer, I think, creates promise for us to take race into account more actively in our public policy making. And as a council member, I would work to make the REACH Act a reality. But I also would push it to adopt specific policies that we know are there that can address systemic racism, like fighting to make sure that at-risk funds in DC schools are adequate and actually getting to the schools where they're supposed to go, like fighting for raising the tip minimum wage to the full minimum wage, like ending the city's food deserts, like fully meeting our affordable housing needs and making sure that we're building affordable housing throughout the cities. To me, those are just some of the keys to addressing racial inequities in our city.
Hi, my name is Will Merrifield. I'm a candidate running for DC Council at large. I'm running for David Grasso's vacated seat as an independent. For the last 8 years, I've worked at the Washington Legal Clinic for the Homeless. At the legal clinic, I was a housing attorney, and I've represented tenant associations across the District of Columbia. I fought to keep housing affordable through large-scale redevelopment projects. I'm running a campaign that is focused on pushing back against current development policy in Washington, D.C., which gives hundreds of millions of dollars of our taxpayer money and hundreds of millions of dollars of our public land to politically connected developers in order to build luxury units that people can't afford, that is exacerbating the affordable housing crisis, causing mass displacement and homelessness. We're running a campaign in direct opposition to that, and I look forward to discussing these questions today.
This question is on rent control. Approximately 90,000 families live in apartments that are under DC's rent control program, making it DC's largest housing program. The DC Council's temporary universal ban on all rent increases exposes the need for increased tenant protections. What changes, if any, would you make to DC's rent control laws?
Support the platform of the Reclaim Rent Control Coalition. So I would support those recommendations being implemented and legislation. I would support and work with the Reclaim Rent Control Coalition to get their legislation approved. I think that what's key for rent control is, one, to eliminate the loopholes, which are the hardship petitions and the voluntary agreements, and two, to expand the amount of units that are covered under rent control. When I was an attorney at the Washington Legal Clinic for the Homeless, I represented a lot of tenant associations that were going through the hardship petition process. And at that time, and it probably still is this way today, the rate of return that the landlord was guaranteed, they could implement those higher rents as soon as they filed the petition. So a tenant didn't even have the due process to allow an attorney to challenge the hardship petition before those rents went up. And what would happen was, as an attorney, when I did get involved, the landlord would immediately, through their attorney, offer a voluntary agreement and say, okay, we won't implement the hardship petition on your client if your client agrees to allow me to raise rents 100% once they move out. So those sorts of loopholes are ways in which, developers and landlords are taking vast swaths of currently rent-controlled units out of rent control, and they need to be eliminated and stopped. And again, new units coming online need to be covered by rent control. So we need to expand the amount of units coming online, eliminate loopholes.
Thank you. This question is on the eviction crisis. Thousands of families in DC are unable to pay their rent and are facing eviction when the state of emergency ends. What would you do to address this looming crisis?
The rents have to be canceled for people that have lost employment or had their income affected due to COVID-19. It's very, very simple. The government has told people that they can't go to work through this public housing crisis or through this public health crisis, which was the correct thing to do to prevent the virus from spreading. But we cannot then expect, those workers to pay rent when they were told that they can't go to work. So we need to cancel rents for, people who have this issue. Right now, the DC government has proposed repayment agreements for people that, have been affected by this crisis. I don't think that's going to be enough. Even a repayment agreement, someone has to repay 6 months, 8 months of rent. It's not going to work for people. So we have to cancel rents. The government has to step in and subsidize those landlords should they need subsidized and pay rents for people. Moving forward, I think it's really important that we move to a new system. I'm running on a social housing platform. Social housing is non-means tested affordable housing. So the way it works is a municipality builds the housing itself. We're basing our model off the model in Vienna, Austria. The municipality builds housing itself. It's non-means tested. Anybody can access it, pay 30% of their rent. Higher rents subsidize lower rents. So people making more money subsidize people making less money, because we have eliminated the profit motive of housing. 100% of people's rents is able to be used productively. So your rent, 100% of it gets invested back into the building, covers the operating costs of the building, and at the end of the month, what would be a profit for that developer turns into a surplus for the building to pay down construction costs. So to get to housing as a human right, we have to decommodify. That's what my platform is premised on.
Thank you. This question is on public housing. The DC Housing Authority states that the more than 6,600 units of public housing are in disrepair and need up to $2.5 billion to make critical life-saving improvements over 20 years. What would you like to see happen in public housing, and what would you do to achieve this?
The public housing situation in Washington, D.C. is disgraceful. It's disgraceful all over the country. In Washington, D.C., it's specifically disgraceful. I've represented tenant associations against slumlords who use, purposeful neglect to drive people out and to demolish buildings and build luxury apartments. That is exactly what's happening with public housing. Public housing for years, I have been part of coalitions, and Power DC has led the way in this work in a lot of ways, to call for the investment of local dollars into our public housing stock to make needed repairs. The government of the District of Columbia, our local elected leaders, has refused to do that. And I believe that they've refused to do that because they have a plan to privatize public housing and severely decrease the amount of affordable units that are at places like Berry Farm, that are at places like Kenilworth, Park Morton. So what I would propose, first and foremost, public housing should not be privatized. If the federal government will not fund public housing as it needs to, which the federal government doesn't provide enough funding, then the local government, our local elected leaders, have to use parts of our robust budget. We just passed a $16 billion budget in order to fund repairs and keep public housing or make public housing a safe place. We should retrofit public housing with the latest green technology. We should make it a jobs program. We should give people in public housing communities work in order to retrofit, rebuild, repair their own communities. So I would not privatize public housing, and I would have local money set aside in order to make sure that it is habitable, and not only habitable, but nice.
Thank you. This question is on homelessness. From encampment clearings to the threat of COVID-19 outbreaks in shelters, we know that DC's homeless service programs are not working for many residents. What would your priorities be around addressing homelessness?
I mean, homeless services do not work for people. Like I said, I worked at the Washington Legal Clinic for the Homeless. What people don't understand is that homeless individuals many times need a lawyer just to access shelter. There is no right to shelter for single homeless individuals. for families, there is, but it's so hard to access without a lawyer. Why? Because the government knows once people are able to access shelter, then they cannot be kicked out of shelter until they have housing on the back end. And we do not have any affordable housing to put people in. Added to that, we're using short-term subsidy programs to house people when they are able to be housed. This has led to our taxpayer dollars through these short-term subsidy programs subsidizing slumlords and exiting families into terrible situations on the back end of their homelessness, causing children and families to go through repeated trauma. So what we need to do is we need to decommodify housing. We need to get to a human right to housing. The only way to get to a human right to housing is through the elimination of the profit motive from our housing system. Just like healthcare, I do not believe universal coverage or a human right to housing is possible through the private market. What we're doing is we're using our money to subsidize the private market to actually drive up cost and make the problem worse. So what we are proposing, I said earlier, is social housing. It is a model that is very common around the world. It's different than public housing in that it actually pays for itself. And the only reason that a social housing model is not the norm in the United States is because developers have too much control over housing policy. So we're going to fight to decommodify, to remove the profit motive, and create a true human right to housing.
This question is related to workers in DC. The impacts of COVID-19 have revealed the lack of a real safety net for workers in DC, particularly undocumented workers and those working in the informal and gig economy. How would you address these issues?
Have to reduce the cost of housing for people. Undocumented workers, a lot of them are not making sufficient money to afford market rate rent in Washington, D.C. Market rate rent in Washington, D.C. is $3,100 a month. That works out to $38,000 a year. A worker making minimum wage work makes about $31,000 to $32,000 a year. So there is not enough of a safety net there. There's no safety net there, as a matter of fact. So we have to provide protection specifically to undocumented workers. I thought it was disgusting in the last budget go around that undocumented workers were left out of these, proposed money, to give people money due to COVID-19 and make sure that they had, money available to them through the government to make up for the crisis. But I would propose that DC, I would want to work with undocumented workers and advocates for undocumented workers and communities to make sure that we're doing everything we possibly can to make sanctuary a real thing. And we're not just using that as a slogan as local politicians. I want to invest in all communities, specifically through a housing policy that removes the profit motive. I know I sound like a broken record, but if we build housing in Washington, D.C., that everybody can access, only paying 30% of their income and rent. And if that is just the way housing policy operates in Washington, D.C., then undocumented people will be able to live in that housing and to participate in a social housing model. So what is really key is to bring down the cost of living. And the only way to do that is to decommodify the housing market.
Thank you. This question is related to racial inequities in DC. The coronavirus pandemic and Black Lives Matter movement have brought to the forefront issues of systemic racial inequalities in DC. We know that around 80% of the COVID-19 related deaths in DC have been Black residents, who only make up about 46% of the population. What do you see as some of the underlying factors contributing to these disparities, and what would you do to tackle them?
What I see over and over in Washington, D.C. is that communities of color, Black communities, Latinx communities are systemically disinvested in. And what I've seen, take Brooklyn Manor, for example. I'm the tenant association attorney at a housing complex called Brooklyn Manor. It's 535 units of deeply affordable housing, primarily Black working class residents. The developer there wants to rip down all 535 units, build 1,750 units in their place, but greatly reduce overall affordability and greatly reduce the amount of large bedrooms that are there for people. So they want to displace an entire community, basically. The local government, our local elected leaders, gave that developer $47 million to do that. $47 million of our taxpayer dollars went to a developer whose plan is to rip down a community primarily consisting of working class Black people. So what I would do if I was a council member is that I would propose that we invest $47 million into the Brooklyn Manor community as opposed to investing in ripping it down. Brooklyn Manor is 22 acres of land. If we invested $47 million into those people that live on those 22 acres of land, those residents that have been systemically disinvested in, then we could change outcomes for that community with respect to economic justice. So I think that that's the issue with the way COVID-19 impacts people, housing impacts people. There are certain communities that are disinvested in. We need to change that.
I'm at-large council member Robert White. I'm serving my first term on the council. I ran for council because I grew up in the city, and I have seen over the years the displacement of so many people, including my family, and the loss of businesses that I grew up with. And I believed and still believe that as a local official, I can make more impact on the city that I love and the people that I love than I can in any other position. It's been an honor to serve for the past 3.5 years. I've focused on economic and racial equity and inclusion, and that's what I hope to continue to do in a second term.
Great, thank you. So our first question is approximately 90,000 families live in apartments that are under DC's rent control program, which, as you know, is currently up for reauthorization. The DC Council's temporary universal ban on rent increases exposes the need for increased tenant protections. What changes, if any, would you make to DC's rent control laws?
I think that rent control is a complex issue. As a huge benefit, we know that rent control has helped to slow the displacement of many people, especially, I believe, people of color, from a city that is quickly gentrifying and becoming unaffordable. However, I have concerns about rent control as a tool because one is that it doesn't necessarily strongly enough protect people with low incomes. Rent control is not means tested. And so what we see is people in more affluent neighborhoods occupying rent control units, even though they have substantial income. And in lower neighborhoods, we see people occupying rent control that have substantially lower incomes. And so there is an inclusionary issue and a segregation issue that does concern me. My hope is that we can study this deeply, very quickly, and figure out the best path forward that both protects affordable housing in our city, but also really preserves that housing for the people who need it most.
Great, thank you. So the council has enacted legislation that prohibits rent increases during the state of emergency and evictions until 30 days after the crisis has ended. We know that nationally about a third of tenants could not pay their rent on April 1st, and that in DC over 87,000 workers have filed for unemployment. So the statistic may be higher in the district. While the courts in the district are closed to the public, until recently, landlords continue to file eviction cases online so that they could push evictions through as soon as possible. As the crisis continues, tenants will continue to fall behind on their rent and accrue debt. What have you done and what would you do to address this crisis?
As we struggle through the coronavirus epidemic, which is different than anything any of us have ever seen, I have been working aggressively and very quickly to protect people who already were on the margins. I work with my council colleagues in emergency legislation to prohibit evictions and prohibit foreclosures, and I'm trying to push even harder on the prohibition for foreclosures, as I've been doing for many weeks, to protect all residents. We also have pushed building owners to apply for mortgage deferrals and to pass that savings on to their residents so that people who have lost their jobs and lost income as a result of the coronavirus don't have to overextend or become subject to eviction after the emergency ends. We have a lot more work to do to protect residents. I really worry about what will happen after the public health emergency when these protections are no longer in place. So I'm working very hard to figure out permanent stopgaps to protect our residents from losing their housing.
Okay. So the DC Housing Authority states that the 6,600 plus units of public housing need up to $2.5 billion in deferred maintenance and capital improvements. And the agency has charted a 20-year redevelopment plan. What would you like to see happen in public housing, and what would you do?
Well, what I want to see happen in public housing is the same thing that I believe people who live in public housing and people who care about folks who live in public housing want to see. We want to see stable and dignified housing. As a council member, I've made it a point to visit some of our public housing residences, and what I've seen are things that I would never want my own family in. I've seen mold in units with babies as young as my own, and I find that wholly unacceptable. The position we find ourselves in is similar to the position that Metro has been in for many years, with a deferred maintenance backlog that is larger than anything we can cover in a short period of time. So there has to be a dedicated stream of funding that is matched to the need for repairing and maintaining public housing, and certainly we cannot afford to lose any and should be looking to add more public housing to protect our residents.
From encampment clearings to the threat of COVID outbreaks in shelters, we know that DC's homeless services programs are not working for all residents. How would you ensure that DC residents have safe, quality, and affordable housing?
Last year, I was chair of the Metropolitan Washington Council of Governments. What I did was I led the board of elected officials from across the entire region to a unanimous commitment to constructing over 320,000 new housing units over the next 10 years to help meet our need of affordability. This housing would be focused on those in middle and lower income, because that is not what we are seeing developed in large enough numbers across our city. So the first thing we need is more housing, and we need it quickly. We have to develop partnerships that allow us to get there more quickly, such as working with religious institutions that have land on which we can build housing. We also have to make bolder steps to protect our current housing. Too often we are seeing, including I've seen it in my own neighborhood, housing that was affordable was not in the best shape, but was affordable, where the tenants were pushed out and it was converted into luxury condos. We have to stem that tide. Finally, when we talk about homelessness, we cannot forget about or neglect the link to mental health. We have a severe mental health and addiction issue in the city that we have to address hand in hand with all of our efforts toward housing.
Thank you. So the impacts of coronavirus have also revealed the lack of a real safety net for DC workers, particularly undocumented workers and those in the informal and gig economies. How would you address these issues?
I've been working actively and aggressively to address these issues. With respect to our undocumented residents, I have been fighting hard with a few of my council colleagues to create funding to protect those people and families. They are part of our communities, and they have the exact same needs and vulnerabilities that the rest of us have. We also worked very hard to expand unemployment insurance to people who work in the gig economy, whether people delivering groceries or musicians who previously did not qualify for unemployment insurance, but because of the fight that I've engaged in and some of my colleagues, we've been able to help create a safety net for them that we need to make permanent.
The last question, the coronavirus pandemic has brought to the forefront issues of systemic inequalities in DC. We know that about 79% of COVID-19 related deaths in DC have been Black residents, who make up only about 46% of the population. What do you see as some of the underlying factors contributing to these disparities, and what would you do to tackle them?
We've known about health disparities in communities of colors for years before the coronavirus hit. This issue has really just shined a brighter light, and I hope has really pushed to the forefront the need to address these underlying issues. The two biggest issues are access to healthcare and fresh foods, which are gaps that we can close, but we will have to work really aggressively to do that. In the middle of the pandemic, we can't fix things that became broken over many, many years. We also have to make sure that we are creating more opportunities for people in lower incomes who are our frontline workers at our grocery stores, delivering groceries, and who are susceptible every day, but whom we are not working hard enough as a city to protect during the coronavirus epidemic.
Thanks for watching, and don't forget to vote. Remember that you can vote for 2 at-large candidates because there are 2 at-large seats up. There's a full list of candidates on the DC Board of Elections website. You can also go there to confirm your registration status. You need to register before October 13th in order to receive a mail-in ballot. You don't have to request a mail-in ballot though. They will be sent to all DC residents. You can either return them by mail or you can put them in a drop box. These drop boxes are going to be available around the city in public locations like libraries. You can also vote in person. Remember to vote early. You can vote starting October 27th at 16 vote centers, and on election day, 90 vote centers will be open.